Namaste. Today's video is on research variables. The term variable, from the name itself, something that varies, not consistent, liable to change, varies from person to person, time to time, place to place. It is measurable or potentially measurable component of an object or event that may fluctuate in quantity or quality. For examples of some qualitative as well as quantitative variables: age, gender, height, weight, income, expenses, family size, class grades, blood pressure, lab values, temperature, pain, stress, anxiety, blood group, color, vehicle type, test scores, so on. I am giving lot of examples so that you will have a click with regard to for the beginning researchers to start with a research problem. Research variables are qualities, properties, characteristics, behavior of people, individuals or group, objects, situation that changes or vary. Two variables that matters with research hypothesis are dependent variable and independent variable. Next, regarding types of research variables. Variables can be generally classified as quantitative and qualitative variables. Quantitative variable, in this, data or information obtained are numeric in terms of numbers, so-called numeric variables. Example, age. Age as years. In years, we will tell the age, 20 year, 21 year, or 40 years. We can classify the age group like 20 to 25 or 26 to 30, 31 to 55 or 50 to 60, 61 to 70 and so on. Number of members in the family or family size, we will tell it as 1, 2, 3, 4, 5, so on. This quantitative variable can be discrete and continuous. We will come to that later. Then next is, what is qualitative variable? Qualitative variable is a characteristic not capable of being measured but can be categorized to possess or not possess some characteristic, present or not present, or present or absent. Qualitative expresses a qualitative attribute. Example, gender, race, religion, social status. The quantitative variable can be divided into discrete variable and continuous variable. Discrete consists of whole numbers. Value is obtained by counting 1, 2, 3. For example, number of children, 1 child, 2 children. Number of patients, number of antenatal visits, number of births, family size. These all are discrete variables. Continuous variable, value obtained by measuring. How values along a continuum can assume an infinite number of values between 2 points, 1.1, 1.2, or weight 30.5 kg, BP reading, temperature, height, weight, blood values, biochemical values, distance, volume, all come under continuous variables. Qualitative variable can be categorical variable. Example, religion, gender, race, social status. Again, these categorical variables can be nominal variable and ordinal variable. Nominal, It cannot be ranked or logically ordered like ordinal variable. Gender, race, religion, color. We cannot give any rank for it. But in ordinal variable, it can be ranked or logically ordered, but no numeric difference between each category. Or even though we are giving rank for it, for occupation, no occupation, daily wages, technical, professional, we are ranking it, but we are not giving any value for it. Clothing size, XXL, XL, large, medium, small. We can rank it. Rating scale responses in a survey like agree, disagree, undesirable. So these all comes under ordinal variables. So quantitative variables can be discrete variable and continuous variable, and qualitative variable categorical variables. Then independent and dependent variables are the important variables with regarding testing of hypothesis. Experiments are usually designed to find out what effect one variable has on another. Researcher manipulates the independent variable and see what difference is there in the independent variable. Some differences between independent and dependent variables are presumed cause is independent variable and presumed effect is the dependent variable. Independent variable can be called as manipulated variable that is being examined or tested. For example, if we want to find out the effect of some program or some intervention or some drug, that is the manipulated variable. That is the independent variable. And dependent variable is also called outcome variable, the variable capturing the outcome of interest. Dependent variable or responding variable that is measured or observed. So the effect on the independent variable is observed in the dependent variable. Variables are not inherently dependent or independent. So dependent variable in one study can be an independent variable in another study. Dependent variable in one study could be an independent variable in another. Example, effect of an exercise intervention on osteoporosis. Here, independent variable is exercise intervention and dependent variable is osteoporosis. But in another study done to find out the effect of osteoporosis on bone fracture. So here, independent variable is osteoporosis, bone fracture is the dependent variable. Same way, effect of counseling on unwanted births, effect of unwanted births on child abuse. Then other names for variables like attribute variables. Variables are often inherent characteristics of research subjects. Example, age, blood group, gender. All these are attribute variables. We cannot change it. Active variable that is manipulated by the investigator. Again, independent variable. So, the manipulation done by the investigator, that is active variable. Then comes the extraneous variable and confounding variables. These are more or less the same, but there is some little difference. Extraneous variable, any variable that researcher is not investigating, that can potentially affect the dependent variable of research study. The problem with this is it threatens the internal validity of the study by providing alternative explanations for results. Internal validity, that is, the extent to which researcher is confident that the independent variable is truly causing or influencing the dependent variable, and that the relationship between the independent and dependent variable is not the spurious effect of an external variable. That is, independent variable itself has effect on dependent variable. If we are manipulating, or if you are doing some study and the change in the independent variable is purely the result of the independent variable of your study. No other factors affect the dependent variable. We will see that with many examples. Confounding variable. Type of extraneous variable that affects both the independent and dependent variables. Confounding variables influences the dependent variable and also correlates with or causally affects the independent variable. Confound the true relationship between variables. Same thing, the change in the dependent variable is truly because of the independent variable, but there comes the effect of these confounding variables. To make it more clear, the extraneous and confounding variable. Confounding variable has an effect on independent as well as dependent variable, whereas extraneous variable has an effect on dependent variable only. That's the difference between confounding variable and extraneous variable. In research study, this can be controlled by different methods. This extraneous and confounding variable that depends on the study and depends on the variables, it can be controlled so that the true effect of the independent variable can be achieved on the dependent variable. Some examples for these are research to find out the relationship between exercise level, that is the independent variable, and body mass index, dependent variable. Age's effect on these factors becomes a confounding variable that changes the study results. So age has an important role in the body mass index. So here acts the extraneous variable. Inactivity or lack of exercise leads to weight gain. Here many factors will affect the weight gain, like amount of food, type of food consumed, gender, men eat more than women, hormonal problems. All these may affect the weight gain. Sleep deprivation and driving ability. Many other factors affect, like road conditions, driving experience, and other factors. Preoperative preparation and postoperative pain and anxiety. Preoperative preparation on postoperative pain and anxiety. Again, the other variables affect are age, gender, comorbidities, previous surgery, etc. Activity level and weight gain. Again, age, gender, comorbidities, eating pattern. All these affects weight gain. Whether offline or online classes are more effective for students' academic score. Extraneous variable that might unintentionally influence the outcome for offline as well as online classes are internet facility, motivation, parental support, absenteeism. Many factors will affect. Then comes another variable, intervening variable or mediator variable. It's a theoretical variable. Researcher uses to explain a cause or connection between other study variables, usually dependent and independent ones. They are associations instead of observations. Example, if wealth is the independent variable and a long lifespan is a dependent variable, the researcher might hypothesize that access to quality healthcare is the intervening variable that links wealth and lifespan. Here, the researcher is mainly interested on two variables like wealth and long lifespan, but quality healthcare is an important intervening or mediator variable. Then control or controlling variables. Characteristics that are constant and do not change during a study. They have no effect on other variables. Researchers might intentionally keep a control variable the same throughout the research to prevent bias. Example, during an interview technique of data collection, many factors affect the interviewee. like the atmosphere, the constancy of environment, time, duration of questions. So many other factors may affect the subject. So this has to be controlled. Same with an experiment also. Many factors to be controlled in order to get the uh, exact result for the independent variable on the dependent variable. Then composite variable. Two or more variables combine to make a more complex variable. For example, if we want to assess the overall health of an individual, we take different variables to come into conclusion regarding the overall health. Example, weight, blood pressure, lipid profile, so on, comorbidities. So all these determine overall health of the individual. Then demographic variables. Demographic variables are independent variables by definition because they cannot be manipulated. Either categorical variable, like gender, male, female, transgender, race, marital status, married, unmarried, widower, education, occupation, location, location of the house, urban, rural, semi-urban, or continuous variable, age. Different classifications are there. Years of education, 1 to 1.5 years, like that. Income, family size. Hope I have covered all about research variables. My next video will be on hypothesis. Please give your valuable suggestions and comments.